Well, certainly, as you have mentioned, we look at a number of studies, and it was great for us, first of all, to be able to get together with a group of colleagues because, each of us practice in different area of the country. We have different style and different way of managing our patient. But it was good for us to get together to share some of our thought. And it was very helpful and very aspiring for us actually to see the evolution of time over the last few years. We start out, for example, with the 7-Up study, which was to me somewhat of a very alarming, concerning, because we know that in that study, after 7 years or so, the patient did not do very well. It's much worse than what we have expected. And one of the concerns we had at that time was that were the patient in the study undertreated? Because in this era, we at retina specialists expect our patient to do a lot better than that. We want them to be able to maintain the vision, not losing any further vision, and gain as much vision as possible. So certainly when the 7-Up study was first published, it was quite alarming. Fortunately, since then, we have seen additional information, and now, since we're in this era where we practice everything based on evidence, it was very helpful to see the outcome of the View 1, View 2, View 1 study. We also talk about a range study as well, too. So this has shown to us that if one were to continue to treat the patient properly, and in a way not to neglect them, but to treat them as they needed, and not to underestimate the disease severity and the chronicity of the disease, one is able to maintain very good vision for our patient and keep them gained. For example, that's how the outcome of the extension of the View 1 study was shown. After the number of years, the patient very much maintained the same type of outcome that we all enjoy seeing from the View 1 study initially. So that was very nice to be able to see that. We also have discussed among our colleagues today as well too, and all of us are quite comfortable with the fact that after so many years now of using anti-VEGF therapy, especially in this elderly group of patients with neovascular AMD, none of us really had any true concern for any type of systemic side effects, systemic outcome when we use this subject, when we treat this subject chronically with anti-VEGF therapy. In other words, when one look at systemic side effects and systemic event, there was no additional data, no additional concern or no concern from this long-term study. It is not indicating that, for example, that after a number of years of using anti-VEGF therapy, patients were more likely to have heart attack, more likely to have cerebral vascular event. Unfortunately, we did not see any of that, so that was very, very good. We also talk a little bit about whether or not chronic use of anti-VEGF lead to ocular concern, for example, development of atrophy. And we all agree that yes, that is a phenomenon that we do see in neovascular AMD. The question would be, would that be a part of the disease itself that respond when we treat anti-VEGF, or is it something that related to the actual treatment? Because certainly anti-VEGF therapy is being used in other indications, for example, diabetic macular edema or vein occlusion with edema, but we don't see any of this atrophy develop in that. So could it be something about neovascular AMD and the effect on the neovascularization in AMD that lead to this aspect? But certainly we want to make sure that we treat the patient properly and not under-treating them. And I think that was the message. The message coming out from this roundtable today was quite great. Continue to treat our patient as they need them. Do not under-treat, and certainly feel more comfortable regarding not inducing additional side effects or systemic event for them.